All right. Melinda, how you doing? We're here doing adult CPR, health saver, first aid. We're about to get ready to get started. Any questions you have before we get started?
No, sir.
All right, let's get into the video. Pretty much gonna go over the introduction of CPR and get a couple facts and opinions about CPR, and we'll go from there. Sound like a plan?
Yes, sir.
Awesome. Turn the volume up.
Actors should not always be shown wearing personal protective equipment.
It was early in my shift at the cafe, around 8:45 on a Monday morning, and I was still feeling tired and groggy. A customer ran up to the counter and asked, "Does anyone know CPR?" A man had collapsed outside on the patio. Suddenly, I was wide awake. I didn't have formal training in cardiopulmonary resuscitation, that's CPR, but I had learned some skills from the American Heart Association website and from scouting when I was a kid. At first, I was nervous, but there was no time to waste. Somebody needed help now. Outside, the adrenaline kicked in like a shot of espresso, and I knew exactly what to do. The customer had collapsed in a patio chair. I'll never forget his face. It was pale as a piece of paper. He wasn't breathing, moving, or responding. While someone called 911, I lowered the man to the patio. I remember thinking, I have someone in my arms who is dying, so I started CPR. I put both hands on the center of his chest and just started pushing, hard and fast. I kept doing chest compressions and breaths for about 2 minutes until medical help arrived. After medical help took over, I washed up, tied my apron on, and went back to serving coffee. But for the rest of my shift, I wondered how that customer was doing. Later, I found out he was a 66-year-old man named Mike. He survived his cardiac arrest and is doing well. I also found out that most people who witness a cardiac arrest either don't know CPR or are afraid to do it. So, they call 911 and then they wait. Medical help gets there as fast as they can. But in the United States, it still takes an average of 4 to 10 minutes for them to reach someone in cardiac arrest. That means receiving CPR from a bystander is a person's best chance to survive until medical help arrives. It also means any CPR is better than no CPR. My career goal is to be in law enforcement and to do search and rescue. But you don't have to be a medical professional to help save a life. By learning hands-only CPR, you too can be ready to help someone in cardiac arrest. It might even be a friend or a family member whose life is in your hands. On your next coffee break, why not take the time to learn hands-only CPR?
What do you think they'll do? Well, I hope they'll harvest. Well, based on your proposal.
What would you do if someone collapsed suddenly in front of you? Although Kurt stepped up and helped someone he didn't know, you are much more likely to be in a position to save the life of someone you know and love, like a parent, child, spouse, or friend. Today, you'll learn the skills to help.
Okay, so before we go any further, I guess that was kind of a good example showing us why CPR is so important. And so, you know, it's so important for so many people to know CPR because you never know what situation you're going to be involved in. So I think that was a good video to show us why it's so important, and why so many people should want to learn CPR, because you never know whose help you're going to need at that time.
Exactly. In an emergency, but that's only half the battle. What would you do if you were standing in that line for coffee? Would you have the confidence to act? Cardiac arrest can occur without warning or within just a few minutes after symptoms appear, and it can occur in both men and women. However, recent studies have shown that in the United States, women are less likely than men to survive a cardiac arrest, as are underrepresented groups such as Black and Latinx communities when compared with their white counterparts. So it's important to remember that cardiac arrest knows no gender, race, or ethnicity. And in a cardiac emergency, everyone needs CPR to survive. Welcome to Heart Saver CPR AED, presented by the American Heart Association. An emergency can happen anywhere at any time. and this course will help prepare you for the types of emergencies you might encounter. For information on additional topics not covered in this course, please consult your student workbook.
All right, that's our introduction. And now we're going to go down to adult CPR, and they'll show us a couple videos and kind of continue us where we left off at. All righty. So here we'll learn the difference between a heart attack and cardiac arrest, scene safety and responsiveness, compressions and breaths, using an AED, putting it all together. Once we put it all together, we'll do a demonstration of us with the dummy and or with the human and performing CPR. Sound like a plan?
Yes, sir.
Good.
Today, you'll learn CPR, how to use an AED, and other life-saving skills. To help you along the way, your student workbook covers all the material and includes quick reference guides. We recommend you put these guides in your first aid kit for easy access during an emergency. If you complete all the course requirements and demonstrate the skills correctly, you'll receive a course completion card. Keep in mind, though, that studies show you should frequently review the course information and practice these skills to maintain your ability to respond to a cardiac arrest. The term heart attack is often mistakenly used to describe cardiac arrest. Although a heart attack may cause cardiac arrest and sudden death, the terms don't mean the same thing. But when and how do you provide CPR? Has the person had a heart attack or cardiac arrest, and what's the difference? Cardiac arrest results from an abnormal heart rhythm. This abnormal rhythm causes the heart to quiver so it can no longer pump blood to the brain, lungs, and other organs. Within seconds, the person becomes unresponsive and is not breathing or is only gasping. Death occurs within minutes if the person does not receive immediate life-saving treatment. A heart attack occurs when the blood flow to part of the heart muscle is blocked by a clot in a blood vessel. If the blocked vessel is not reopened quickly, the heart muscle normally nourished by the vessel begins to die. Heart attack symptoms may include discomfort or pain in the chest, or an uncomfortable feeling in one or both arms, the neck, the jaw, or the upper back. Other signs of heart attack are shortness of breath, breaking out in a cold sweat, nausea, or lightheadedness. For both women and men, the most common heart attack symptom is chest pain or discomfort. However, women are less likely to seek treatment for a heart attack. This may be because they're somewhat more likely than men to experience some of the other common symptoms of a heart attack. These symptoms include shortness of breath, nausea, vomiting, and back or jaw pain, which they often mistake as symptoms of acid reflux, the flu, or normal aging. A heart attack can lead to cardiac arrest. A person in cardiac arrest needs CPR to survive. CPR stands for cardiopulmonary resuscitation and consists of two parts, chest compressions and breaths. When CPR is needed, chest compressions can help blood get to the brain and other vital organs. It's natural to hesitate or to question yourself when faced with an emergency. There are many myths about performing CPR. Myth number 1, true or false? Many Americans are prepared to act in an emergency. False. Most Americans feel helpless to act because they don't know how to perform CPR or are afraid of hurting the person. Unfortunately, less than half the people who need CPR get the immediate help they need before advanced help arrives. Myth number 2, you can hurt someone by giving CPR. Even if someone doesn't need CPR, you're unlikely to hurt someone by providing it. Although it's possible for a person to receive injuries like a broken rib, these injuries are minor compared with death. Survival rates drop by as much as 10% for every minute that a person does not receive CPR. Doing something to help someone is better than doing nothing. Myth number 3, you can be sued for performing CPR. All 50 states have Good Samaritan laws in place to protect people who try to help save a life. For more information on Good Samaritan laws in your state, check your state government's website. Myth number 4, true or false? AEDs should be used only by healthcare professionals. False. AED stands for Automated External Defibrillator. AEDs are safe and easy to use by anyone. We'll discuss AEDs in more detail later. For now, all you need to know is that to operate one, you simply turn it on and follow the prompts. An AED will only provide a shock if the person needs it.
All right. Any questions about any of that? And now, a lot of that, what she was talking about, we're going to take the steps to learn each one. So, awesome. You're doing great. Scene safety and checking for responsiveness. Now we're getting into the meat of it.
When we go about our everyday lives and something like this happens right in front of us, it may take a few seconds to realize that this is actually an emergency. When we do realize the urgency, there are steps to follow to determine whether a person needs CPR. First, before you start providing CPR, you need to make sure the scene is safe. Look for anything nearby that might hurt you. You can't help if you get hurt too. Next, check to see if the person is responsive. Kneel at their side, tap them and shout,
"Are you okay? Are you okay?"
If the person is unresponsive, shout for help. Someone who is responsive moves, speaks, blinks, or otherwise reacts when you tap them and ask if they're okay. Someone who does not move, speak, blink, or otherwise react is unresponsive. Here's a demonstration. While leaning over the person who is down, check to see if the person is responsive. Tap their shoulders and ask,
"Are you okay? Are you okay?"
If the person does not move, speak, blink, or otherwise react, then they are unresponsive. Shout for help.
"Help, I need help."
So on that scene there, very important once we get into the scene, you see what's going on. You want to scan the scene to make sure there's no dangers around. You want to make sure the area is clear. And then once you've done that, then you want to do the tapping to see if you can get them to respond, if they're responsive or irresponsive or unresponsive. And before you start even doing CPR, the simple steps you have to take before. And so checking the scene for safety is very important, because you don't want to help somebody and then you see it's like, oh, it's trouble coming along the way, or because like some people cutting the grass, they might be out there by their lawnmower. You don't want to start CPR and then the lawnmower has a chance of rolling down towards you all. So you just want to make sure the scene is safe and clear. Plus for the EMTs that will be coming along the way, once you call 911, you want to make sure they have a clear scene that they can just pull up to and go straight into.
If someone is nearby and can help, have that person phone 911 and get an AED. Say to them, you, call 911 and get an AED. If no one comes or you're alone, then phone 911 yourself and put your phone on speaker mode so that you can use your hands while assessing the person. You'll also need to get the AED yourself. If you're alone and don't have a cell phone, leave the person while you go to phone 911 and get an AED. Quickly return and continue providing emergency care. If you don't know where the AED is, or if there isn't one available, do not delay the start of CPR. Stay on the phone until the 911 dispatcher tells you to hang up. Answering the dispatcher's questions will not delay the arrival of help. The dispatcher will ask you about the emergency, where you are, and what has happened. In general, dispatchers can provide instructions that will help you. The dispatcher may also tell you how to help the person until someone with more advanced training arrives and takes over. The dispatcher may be able to tell you how to do CPR, use an AED, or give first aid. In an emergency, the sooner you realize that there's a problem and get help, the better it is for the ill or injured person.
Gotcha. So always making sure we call 911. You know, call the professionals at all times. We're professional and licensed to do it, but they're the professionals that might have more tools that can do what we can't, what we're not able to do.
The next step in assessing the need for CPR is to check for breathing. When the person is unresponsive, scan the chest for 5 seconds, but no more than 10 seconds, checking for breathing. If the person is not breathing normally or is only gasping, they need CPR. If a person is gasping, it usually looks like they're drawing air in very quickly. They may open their mouth and move their jaw, head, or neck. You might hear what are called agonal gasps in the first minutes after cardiac arrest. These gasps may appear forceful or weak and sometimes may pass between gasps because they usually happen at a slow rate. The gasp may sound like a snort, snore, or groan. Gasping is not regular or normal breathing. It's a sign of cardiac arrest in someone who is unresponsive. Let's look at these steps all together in assessing the need for CPR. Before you provide CPR, check to make sure the scene is safe. Tap and shout to see if the person is responsive.
Are you okay? Are you okay?
If the person is unresponsive, shout for help.
Help, I need help.
If someone comes, have that person phone 911 and get an AED.
You, what's your name?
Maria?
Maria, I need you to phone 911.
Okay. If no one comes to help and you have a cell phone, phone 911 and put it on speaker mode so you can hear the dispatcher's instructions. You will also need to get the AED yourself. If you're alone and don't have a cell phone, leave the person while you go to phone 911 and get an AED. Quickly return and continue providing emergency care. If you don't know where the AED is or if there isn't one available, do not delay the start of CPR. Next, scan the chest for 5 to 10 seconds, checking for breathing. If the person is not breathing normally or is only gasping, you need to begin CPR immediately. If the person is breathing normally and is unresponsive, place the person on their side until someone with more advanced training arrives. The video will now pause while you get in position to practice scene safety and assessment.
All right. So we're about to practice safety and assessment. So pretty much just going over what they just instructed us to do. So you see the body. We'll call him Breathing Billy today. We see Breathing Billy. He's laying on the ground. As soon as we see him, we're scanning the scene. We want to make sure everything is all right. There's no dangers around. We want to make sure that they're breathing. We want to tap them. Hello, hello. Are you responsive? Are you responsive? Once we see that they're not responsive, then you just want to scan. See how they're breathing. Once we see how they're breathing, once again, if they're not breathing, then we want to immediately start CPR. We want to make sure we phone 911. Got to make sure we phone 911. If you have to call them yourself, you just set the phone down next to the person and put it on speakerphone. That way you're able to talk to the cop. And then pretty much go into what we're going to learn more of.
Before you provide CPR, check to make sure the scene is safe. Tap and shout to see if the person is responsive. Are you okay? Are you okay? If the person is unresponsive, shout for help. Help! Help! I need help. If someone comes, have that person phone 911 and get an AED. You, call 911 and get an AED. Next, scan the chest for 5 to 10 seconds, checking for breathing. If the person is not breathing normally or is only gasping, you need to begin CPR immediately. If the person is breathing normally and is unresponsive,
Turn them on this
place
side.
the person on their side until someone with more advanced training arrives.
Awesome. Okay. So pretty much now we'll have you go through this. So say you're coming up to the body, and
Before you provide CPR, check to make sure the scene is safe. Tap and shout to see if the person is responsive. Are you okay? Are you okay? If the person is unresponsive, shout for help. Help! Help! I need help. If someone comes, have that person phone 911 and get an AED. You, call 911 and get an AED. Next, scan the chest for 5 to 10.
So we'll go back one. Yeah, you got good job. Okay. So boom, you scan the area first.
Before you provide CPR, check to make sure the scene is safe. Tap and shout to see if the person is responsive. Are you okay? Are you okay? If the person is unresponsive, shout for help. Help! Help! I need help. If someone comes, have that person phone 911 and get an AED. You, call 911 and get an AED. Next, scan the chest for 5. I need help. If someone comes, have. Okay? Are you okay? If the person is unresponsive, shout for help. Help! Help! I need help. If someone comes, have that person. 9.
And then we're going to call 911.
Right.
And then we'll start going into chest. Well, we check their breathing.
Yes. Scan to check to see how they're breathing.
And get an AED.
And then once you see that they're not
call
responsive,
911 and get an AED. Next, scan the chest for 5 to 10 seconds, checking for breathing. If the person is not breathing normally or is only gasping, you need to begin CPR immediately. If the person is breathing normally and is unresponsive, place the person on their side until someone with more advanced training.
Right. So on this one here, once we get to that part, it's simple. You don't want to roll over onto them, just like right there in the middle of the sternum. Almost like a rhythmic heartbeat. So we'll do that probably on this next scene that's coming up. But we definitely just want to make sure we're scanning the scene, making sure that we're calling 911, making sure that we're getting help, getting AEDs. We want to scan to make sure, scan the chest and the body to see how the breathing is. If they're not responsive, immediately going into CPR if they are responsive. But if they're not responsive but they are breathing normally, we just want to turn them over on their side until the professionals get there. Sound like a plan?
Yes, sir.
Good. All right, we'll go to the next. Well, let's do this one more time just to make sure we got it.
Arrives.
So I can do it without that on if you want me to.
Oh, yeah, go ahead.
Okay.
Yeah, go ahead.
Okay. So first we're going to make sure there's nothing that can hurt me in the area.
Right.
Then we're going to check and ask if they're okay. So, are you okay? Are you okay? And then we'll check their breathing, make sure.
You want to shout for help?
Yes, shout for help and get an AED.
Yes.
Okay, then
I'm
check
here,
their,
I'll call 911.
yes, and then we check their breathing.
Right.
And then if they are responsive, we roll them on their side, right?
Right. If they're unresponsive but breathing normal,
breathing, yes.
we roll them on their side.
If
yes.
not, then we'll just go
straight to the CP. Perfect. All righty, that's cool. We'll go to the next step now. I just want to make sure that we got that part down. We're just going to start forming it all together. All righty. Good job.
She had us like acting it out down in our last class. bunch of us too. So.
It got real dramatic in there.
Put the mask over the mannequin's mouth and nose. Tilt the head back and lift the chin while pressing the mask against the mannequin's face. Now that you've got the mask positioned, give 2 breaths while watching for the chest to rise.
Wow, that was weird. Hold on. The video went weird on me. Okay, compressions and breaths.
Now, let's talk about chest compressions and hands-only CPR. Bystanders who are not trained in CPR are encouraged to provide compression-only CPR, also called hands-only CPR, if they see a teen or an adult collapse. There are 2 simple steps to follow. Phone 911 and push hard and fast in the center of the chest. High-quality CPR requires 2 main skills: providing compressions and giving breaths. Compressions are the most important part of CPR. We'll go over compressions first, and then we'll talk about breaths. A chest compression is the act of pushing on the chest. When you push down correctly on the chest, you pump blood to the brain and other organs. To perform high-quality compressions, you need to do 4 things. Provide compressions that are deep enough, provide compressions that are fast enough, allow the chest to return to its normal position after each compression, and don't interrupt compressions for more than 10 seconds. We're going to demonstrate chest compressions and then give you a chance to practice. When providing compressions, you're acting like the heart because in a cardiac arrest, it's not beating correctly on its own. By providing compressions, you're pumping blood to the brain and other vital organs, keeping them alive until advanced help arrives and the heart can begin beating on its own. You need to push hard, to a depth of at least 2 inches or 5 centimeters, and push fast, at a rate of 100 to 120 compressions per minute. Let's watch this demonstration. Then you'll get to practice. To provide chest compressions, first move the person to a firm, flat surface. Quickly move bulky clothes out of the way. If the person's clothes are difficult to remove, you can still provide compressions over their clothing. If an AED becomes available, remove all clothes that cover the chest. AED pads must not be placed over any clothing. It may seem awkward or uncomfortable removing someone's clothing, especially if you don't know them, but it's a necessary step to make sure the AED pads make direct contact with the skin. Remember, Good Samaritan laws protect people acting in good faith, so fear of legal repercussions shouldn't be a reason to not provide CPR. Place the heel of one hand in the center of the chest over the lower half of the breastbone, and put the other hand on top of the first. Next, push down hard, at least 2 inches or 5 centimeters. It's helpful to keep your elbows fully extended. If you're using a feedback device, your instructor will explain how your device works. When you reach the correct depth, you might hear a click or see a green light, depending on the mannequin you're using. In a real emergency, there won't be any feedback, and you'll have to estimate at least 2 inches or 5 centimeters. You should push hard and fast, at a rate of 100 to 120 compressions per minute. Studies have shown that you're more likely to perform CPR at the correct rate if you're thinking about a song you know with a beat between 100 and 120 per minute. The Bee Gees song, Stayin' Alive, has a great name and is the correct rate for performing chest compressions. The American Heart Association website provides titles of additional songs that can help you give compressions at the correct rate. Finally, you need to allow the chest to come all the way back up after each compression. This is called recoil, and it's an important step that allows the heart to refill with blood. Our aim is to minimize interruptions in chest compressions to 10 seconds or less. This is true in all situations and for everyone, including pregnant women. Do not delay providing chest compressions for a pregnant woman in cardiac arrest. Provide high-quality CPR just as you would for any other adult. High-quality CPR can increase the mother's and the infant's chance of survival. The video will now pause while you get in position to practice chest compressions.
All right. So, coming back to chest compression. On that side. Just interlocking the hands. Straight. Stand alive. Stand.
Hey, that's one way to do it. Okay, so it is.
Good job. Good job. I think we got that one down packed.
To provide chest compressions, place the heel of one hand in the center of the chest over the lower half of the breastbone, and put the other hand on top of the first. Next, push down hard, at least 2 inches or 5. You need to allow the chest Now,
so this here,
we're going to learn the second skill of providing high-quality CPR,
we'll go down,
giving breaths.
just going to cover it.
Breaths are especially important for infants, children, and anyone in cardiac arrest due to choking, drowning, drug overdose, or any other respiratory cause. It's a common misconception that humans exhale only carbon dioxide, when in fact, we exhale a number of compounds, including oxygen. This means that the oxygen in your exhaled breaths is helpful to a person who can't breathe on their own. Before giving breaths, open the person's airway. Opening the airway correctly will help keep the tongue out of the way to make sure your breaths are effective. As you practice this skill today, you'll be using a mannequin. It's important to note that in this upcoming demonstration, you'll see breaths given without a face shield or pocket mask. We'll cover giving breaths with a pocket mask in our next section. But for this practice session, your instructor will provide a face shield and mannequin sanitizing wipes. Face shields are relatively inexpensive barrier devices that are a great addition to any first aid kit. Watch this demonstration and then you'll get a chance to practice. Remember, you don't want to interrupt compressions for more than 10 seconds to give breaths. To open the airway, follow these steps. Put one hand on the mannequin's forehead and put the fingers of your other hand on the chin. Then, tilt the head back and lift the chin. This simple action lifts the tongue away from the back of the throat, opening the airway. It's important to avoid pressing into the soft area under the chin because this might block the airway. While holding the airway open, pinch the person's nose closed with your thumb and forefinger. Take a normal breath. Cover the mannequin's mouth with your mouth. Give 2 breaths. Blow for 1 second for each breath. As you give each breath, you should look down at the mannequin's chest to see it rise. Actually seeing the chest begin to rise is the best way to know that your breaths are effective. Remember, if you give someone a breath and the chest doesn't rise, allow the head to go back to its normal position. Then, open the airway again by tilting the head back and lifting the chin. Give another breath, making sure the chest rises. Don't interrupt compressions for more than 10 seconds to give 2 breaths. The video will now pause while you get in position to practice giving breaths.
All right, so hold on. So we definitely know we want to make sure we tilt the head up, squeeze the nose, and do what we do. That is the weirdest thing.
To open the airway, follow these steps. Put one hand on the mannequin's forehead and put the fingers of your other hand on the chin. Then, tilt the head back and lift the chin. While holding the airway open, pinch the person's nose closed with your thumb and forefinger. Take a normal breath. Cover the mannequin's mouth with your mouth. Give 2 breaths. Blow for 1 second for each breath. As you give each breath, you should look down at the mannequin's chest to see it rise.
Yeah. Towels we can use. Another man. Look at this. May also say if you're at a scene, something like that can happen. So I'm gonna go. Yeah, we definitely want to tilt the head, knock off the air passageway. I'll grab another towel. I just wanted to see the reaction.
Yeah.
You may give breaths with or without a face shield or pocket mask. If you're in the workplace, your employer may provide this kind of personal protective equipment for use during CPR. Many first aid kits also contain these supplies. There are different kinds of face shields and pocket masks, and there are different sizes for adults, children, and infants. So make sure you're using the right size. Pocket masks and face shields are made of plastic and fit over the person's mouth or mouth and nose. Face shields are a thin piece of flexible plastic meant to be a one-time use barrier between you and a mannequin or you and another person. Make sure that the face shield is pulled securely over the mouth and deliver breaths just as you would from mouth to mouth. Pocket masks are reusable barrier devices that can be sanitized between use. They're typically made of hard plastic with a one-way valve, and they protect the rescuer from coming in contact with blood, vomit, and contagious disease. The one-way valve is the part you breathe into. A pocket mask may not be included in a typical first aid kit, but the AHA recommends that you add it. You may need to put a pocket mask together before you use it, but this is usually as simple as popping it into shape and connecting the 2 pieces. And by the way, use the one-way valve you are given for today's practice only, and then discard it. So, let's take a look at how to give breaths with a mask. We're going to show you a demonstration on how to place the mask and give breaths. Afterward, we'll give you a chance to practice giving breaths with the mask. Start out kneeling next to the mannequin. Put the mask over the mannequin's mouth and nose. If the mask has a narrow or pointed end, put that part of the mask on the bridge of the nose, and the wide part of the mask should cover the mannequin's mouth. Tilt the head back and lift the chin while pressing the mask against the mannequin's face. It's important to make a good seal between the mannequin's face and the mask while you lift the chin to keep the airway open. Now that you've got the mask positioned, give 2 breaths while watching for the chest to rise. As you give each breath, you should look down at the mannequin's chest to see it rise. Actually seeing the chest begin to rise is the best way to know that your breaths are effective. Remember, if you give a breath and the chest doesn't rise, you need to reopen the airway and reposition the mask to get a better seal. Give another breath and make sure the chest rises this time, interrupting compressions for no more than 10 seconds total. If the chest doesn't rise, begin pushing hard and fast on the chest again. Now we're going to practice using a mask to give breaths. The video will pause so you can put your mask together and get into place.
All right, so we got our mask already put together.
Put the mask over the mannequin's mouth and nose. Tilt the head back and lift the chin while pressing the mask against the mannequin's face. Now that you've got the mask positioned, give 2 breaths while watching for the chest to rise.
All right. So since COVID, I try to be extra careful about all this, and so but I did bring the towel. We do have the face mask. I feel like as long as you're showing me you can do the breaths, I think that's the best and most important thing. So we can do the tilting the head and doing just the breathing. That'd be awesome.
Alright, so tilt their head.
Mm-hmm.
Then we held it like that, right? And this
Yeah.
is the breath.
Yes.
How many breaths do I do?
2 breaths.
Just 2 breaths?
Mhm.
Okay. And then go into the compressions.
Yeah, go back into the CPR. Awesome, awesome.
For 10 seconds, is that what it says?
30 compressions. It's always 30
Okay, 30
compressions, and then in between the breaths, that's why it's only 2 breaths, because it should just be 10 seconds on the breath. So
Gotcha.
you only want 10 seconds of distraction time from the compressions.
Gotcha.
And that's what that would be. And trying to think what it is. And they said, like if you ever go to a scene and say you don't have all the CPR product, a t-shirt is best to put around because you don't know what someone might have.
Yeah.
T-shirt, towel, something like that. Mm-hmm. Good job. Okay, now we got using an AED.
By now, you've learned how to provide compressions and give breaths with and without a mask. Let's look more closely at using an AED. An AED is a device that can deliver a shock to the heart of a person in cardiac arrest if needed. Even though you may be in the midst of providing CPR, once the AED arrives, use it immediately. CPR combined with using an AED provides the best chance of saving a life. If possible, use an AED every time you provide CPR. During cardiac arrest, the heart quivers and stops pumping blood. An AED shocks the heart so that the heart's rhythm can reset and the heart can pump blood again. To use an AED, you simply turn it on by either pushing the on button or lifting the lid. Once you turn on the AED, you'll hear prompts telling you everything you need to do. AEDs may have 2 sets of pads, a large set to use for adults and a small set to use for children. Make sure you use the large pads on anyone 8 years of age or older. Later, we'll talk about using the smaller pads for children younger than 8 years old. You may have already moved some of the person's clothes out of the way to perform CPR, but you should remove all clothes that cover the chest before using an AED. AED pads must not be placed over any clothing. It's important that the AED pads not touch anything other than the person's bare skin. Peel away the backing from the pads and attach them to the person. Follow the pictures on the pads. You don't need to remove a person's jewelry as long as it doesn't interfere with the placement of the pads and isn't in contact with the pads. It doesn't cause a shock hazard to either the person being helped or the rescuer. However, undergarments should be removed, along with other clothes covering the chest, since they often interfere with proper pad placement. Plug the pad's connector into the AED and follow the AED prompts. Make sure no one is touching the person while the AED analyzes the heart rhythm and before you push the shock button. If the AED recommends a shock, it will tell you to stay clear or not touch the person. If the AED tells you not to touch the person, look to be sure that no one is touching the person, including you, and state something like, "Stay clear," or "Stand back," just before you push the shock button. As soon as the AED gives the shock, immediately resume chest compressions. After this demonstration, you'll have a chance to practice using an AED trainer so that you can see what it's like. You'll need to consider a few special situations when using an AED. First, if the person has hair on their chest, the hair may prevent the pads from sticking. If your AED has only one set of pads, a razor should be included. You can use the razor to quickly shave the area and then apply the pads. If your AED has two sets of large pads, you can try this. Apply one set to the hairy chest, and if the hair prevents the pads from coming in contact with the chest, the AED should tell you to check the pads. If it does, press the pads down more firmly. If they still aren't sticking, rip the pads off forcefully, removing the chest hair. Then, reapply a new set of pads to the bare skin. Water on a person's chest can also be a problem. It could allow the shock to travel through the water between the pads, ultimately preventing delivery of an effective shock dose to the person's heart. If someone is lying in water, you should quickly move them to a dry area. However, if the person is lying in snow or in a small puddle, you may use the AED. And if the chest is covered with water or sweat, wipe the chest before attaching the AED pads. But wipe the chest quickly. It doesn't have to be completely dry. Some people have an implanted pacemaker or defibrillator in the same place where you would put the AED pads. These devices look like a round or square lump smaller than a deck of cards. If you see this lump, avoid putting the pads directly over it. Also, don't place the pad directly over a medicine patch. If a medicine patch is located where you need to place a pad, take the patch off and quickly wipe the chest before you put on the pad. If you're not wearing gloves, make sure you don't touch the underside of the patch. You don't want to get any of the medicine on your bare skin. Use an AED for a pregnant woman in cardiac arrest just as you would for any other person. If your workplace has an AED, you should familiarize yourself with it.
Not too many
Regardless
people
of the
have
type of AED, remember to turn it on first and follow the audible prompts that will lead you through the rest of the steps. Additional emergency equipment may be found in the AED, such as scissors, razors, wipes, gloves, and a barrier device. These items may also be found in a separate emergency or first aid kit. The video will now pause to allow your instructor to lead a practice session with an AED trainer. These trainers simulate what a real AED would do, but they won't provide a shock.
Awesome. Okay, so I have the AED trainers here, and once again, like how they were saying, the pictures show you where to put it. So like, boom, you can just, matter of fact, I'm gonna let you do it.
Okay.
And you just peel it off on the back, and then you can just set it on the spots that it's showing. Perfect. Yes.
Okay.
And then always make sure it's connected. And then let's do this one as well. Nice. And you want to turn your AED on.
Analyzing heart rhythm. Do not touch the patient.
Everybody clear?
Shock advised.
Clear?
Charging. Stay clear of the patient.
And just
Deliver shock now. Press the orange button now. Shock delivered.
and then that's when you would go back.
Start CPR.
Okay. So go ahead
That's
and
when,
start doing it.
And that kind of helps you out to keep up with the rhythm of what you want to go with. Good job. So that's the AED.
Okay.
That's the AED. Most important thing is once you put the AED on, want to make sure we don't have any hair on the chest. If we do have hair, we want to have a way to get it off of there.
Either pull that pad,
Yes.
pull it off, or shave it if there's a razor.
Right, and if they have water, you want to clean that area off. And if they have a medicine patch, you want to snatch that medicine patch off if it's in the way of you putting your AED on. All right, and then once it's on, everybody clear. When it's saying how, make sure don't no one touch the body. You have to be clear because you don't want anything that might influence something negative happen at that time.
Exactly.
All righty, good job. And now we're
Now
about
we're
to put
going
it
to
all
demonstrate
together.
how to put it all together. From scene safety and assessment
We
to
can take it
providing
off.
compressions
And,
and giving breaths to using an AED. Afterward, you'll get a
You're
chance
the
to
first
practice.
person to use it. I had never
First,
done it. I
check
just
to make
got this,
sure the
luckily.
scene is safe. Tap and shout to see if the person is responsive.
Are you okay? Are you okay?
If the person is unresponsive, shout for help.
Help! Help!
Ask someone to phone 911 and get an AED.
So
Okay.
we want to make sure the scene is safe. Tap and shout. See if the person is responsive. If the person is on, I'll do it before you do it.
Okay.
If the person isn't responsive, we shout for help. Ask someone to phone 911 and get an AED.
911 and get an AED.
Good thing I hear and I got one.
Next, scan the chest for 5 to 10 seconds, checking for breathing. If the person is not breathing normally or is only gasping, provide CPR. Make sure the person is lying on their back on a firm, flat surface. Quickly move bulky clothes out of the way. If a person's clothes are difficult to remove, you can still provide compressions over clothing. If an AED becomes available, remove all clothes that cover the chest. AED pads must not be placed over any clothing. Now, tilt the head back and lift the chin to open the airway. Give 2 breaths. Remember, do not interrupt compressions for more than 10 seconds. Give another set of 30 chest compressions. Now, tilt the head back and lift the chin. Give 2 breaths. Once the AED arrives, use it immediately. First, turn on the AED by pushing the on button or opening the lid. Attach the pads to the person's bare chest. Follow the AED prompts and the pictures on the package or pads. Plug in the pads connector. Make sure no one is touching the person while the AED analyzes the heart rhythm and before you push the shock button. Press the shock button if the AED says to, and immediately resume CPR, starting with CPR. Follow the AED prompts and the pictures on the package or pads.
Okay.
Plug in the shock button. Press the shock button if the AED says to, and immediately resume CPR, starting with compressions. Now the video will pause and your instructor will help you practice putting it all together.
All right, I'm gonna hit play again. Let's see if I got this down packed. Let's go.
Now we're going to demonstrate how to put it all together. From
Oh man, my bad, lady.
to see if the person is responsive.
Are you okay? Are you okay?
If the person is unresponsive,
Okay, I'm coming up to the scene. Checking to make sure the scene is safe. Getting any excess that might be in the way. Are you okay? Are you okay? Someone call 911 and get an A&D. Cut. What is an A&D? That's an and. Don't get an and, y'all. I'm sorry. Okay. Starting over. Stay breathing, Billy. Checking the scene. Make sure everything is safe. All right. Are you okay? Hey, are you okay? Someone call 911 and get an AED. Let me ask for help. Let's do this right. Cut from the top, people. Checking the scene. Checking to see if the patient is breathing. Are you okay? Hey, are you okay? Not responsive. Hey, I need help. I need help. Someone call 911 and get an AED quick. Now I want to scan the body to check for any breathing. And now I'm going to begin CPR. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. And then After I've done my 30 compressions, I'm gonna do 30 more. I'm gonna see how they're feeling. I'm still not seeing any breathing. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 12, 13, 14, 15, 16, 17, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Okay. AED comes to the scene. All right, set it right here. There's no hair on the chest. I don't have anything in my way. I'm gonna go immediately to putting the pads on, just as they are shown here. I'm turning my AED on.
Applying pads to patient's bare chest. Analyzing heart rhythm. Do not touch the patient.
Everyone back, get back.
Shock advised. Charging. Stay clear of the patient.
Clear.
Deliver shock now. Press the orange button now. Shock delivered. Start CPR.
I thought that thing would have been counted 30. But then you go back to the compressions, tilt the head. He's breathing. He's responding. Everyone get back. I saved him again. And that's pretty much how that part goes. Thank you. I want to make sure. Did I do it right? Now, I will say when the AED came, I should have plugged it in first.
Yeah, I did know.
So that was a mistake on my end right there. But yeah, that was a mistake on my end. I made that mistake when I was taking the class. But that was a simple mistake. So what we'll do is just perfect.
For help.
Help!
Ask someone to phone 911 and get an AED. It's only
Okay, we did it. And I think I did.
give another set of 30 chest compressions.
So it's one set of 30 compressions and then the breathing?
Now, tilt the head back and lift the chin. Give 2 breaths.
That's what you did.
Once the
Okay, I think I
AED
did
arrives, use it
230
immediately.
compression
First,
sets.
turn on the AED by pushing the on button or opening the lid.
Okay, perfect.
Attach the pads to the person's bare chest. Follow the AED prompts and the pictures on the package or pads. Plug in the pads connector.
Okay, we're good. We're good. All right, you ready? All right. So, boom, she's pulling up.
Okay. Making sure the area is clear,
Perfect.
safe.
Yes.
Okay. Then we're gonna make sure see if they're responsive.
Right.
Are you okay? Are you okay? All right. And after that, we are going to
Ask for help.
ask for help and call 911 and get an AED.
Yes.
Okay. And then
Scan the body for breathing.
Yeah, for like 5 to 10 seconds,
Yes.
right?
Right.
And then after that, we just start the compressions, right?
Correct.
Okay. That's 30.
Yes. 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 5, 6, 7, 28, 9, 30.
Okay.
And then you do your
Mouthpiece, you tilt their head back.
Right.
And then
Perfect.
do 2 breaths.
Correct.
Okay. Then go into 30 compressions again, right?
30 compressions again. And by that time, the AED should be coming up. 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 27, 28, 29, 30. And then breath, 2 more breaths. Hey, Melinda, I'm here with the AED.
Okay. So now we make sure it is plugged up.
And turned on. Go ahead and turn it on.
Analyzing heart rhythm.
Good job.
Do not touch the patient.
I want to tell everybody to clear,
Clear.
get away, get away.
Okay.
Shock advised.
Make sure you're clear still.
Charging. Stay clear of the patient. Deliver shock now. Press the shock delivered.
And then go into
Start CPR.
Yes.
Then you do 2 more breaths again till back. So
All right.
it's
Good job. Good job. Good job. And, you know, the more practice, the more fluent it's going to become. But, you know, it's about making sure we know the steps and all right now. It doesn't have to be perfect. Thank you, though. All righty. So, any questions about any of that?
I don't think so.
Okay, I would just say the most important things when we get to the scene, check scene safety, is that remember that we call for help, and then we get them to call 911, and then we scan, and because we got to make sure help is on the way before we get to going into our compressions and all that. So I think you did a good job. I'm not going to complain about any of that. You know, it's good.
Make sure no one is
We got
touching.
that took care of. All right, let's see what's next. Good job. Now they're going to give us the summary. Yeah, definitely. If you want a cold one.
Now that you've had a chance to practice compressions, you can see that providing CPR requires a lot of effort. It can be tiring to keep up the pace. Therefore, if someone else at the scene knows CPR, take turns providing CPR by switching at least every 2 minutes, even if you're not tired. As you help each other and take turns providing CPR, it's important to give each other feedback. While you're resting, remind the other rescuer to push down at least 2 inches or 5 centimeters at a rate of 100 to 120 compressions per minute, and to let the chest come back up to its normal position after each compression. You've just practiced life-saving CPR and AED use for adults. The video will now pause for your instructor to test you on these skills.
Which is what we just did.
Okay.
So we know that part. We did great. You did great. It's something that you want to say you learn more with repetition, but you don't want this to happen so much that you have to learn with exactly. You want
That's why you have to refresh yourself every so often.
It's a true story.
This section covers the special situation of what to do in life-threatening emergencies due to known or suspected opioids. Across the world, far too many people are dying from drug overdoses. These deaths are largely due to opioids. Common opioids are morphine, fentanyl, heroin, oxycodone, methadone, and hydrocodone. In this course, we'll discuss the use of naloxone, a medication used to reverse the overdose effects of an opioid and help the person survive. Family members or caregivers of known opioid users may keep naloxone close by to use in case of an opioid overdose. An accidental overdose can happen to anyone. If you know someone who has access to naloxone, you may need to use it. It's important to be familiar with how to use naloxone. Drug overdose can lead to cardiac arrest. That's why it's important for you to know how to respond to this life-threatening emergency. If you suspect an opioid overdose, it's important to phone 911 immediately. Common signs of opioid overdose include unresponsiveness with shallow or slow breathing, or even no breathing or only gasping. You may suspect a drug overdose if you see signs of drugs nearby or if there's other evidence of drug use. If you suspect that someone has overdosed on an opioid and the person is unresponsive but still breathing, shout for help, phone 911, give naloxone if available, and stay with the person until someone with advanced training arrives. If the person is unresponsive and not breathing normally, and you suspect they have overdosed on an opioid, phone 911. Get an AED and naloxone if they're available. Start CPR and use the AED. Give the naloxone as soon as you can, but do not delay CPR to give naloxone. If the person is unresponsive and not breathing normally, and naloxone is unavailable, or you suspect they have overdosed on a non-opioid drug, phone 911 and get an AED if one is nearby. After phoning 911, start CPR and use the AED. You've just learned an incredibly important life-saving technique, how to help a teen or adult with an opioid-associated life-threatening emergency. For more information, refer to your student workbook.
Awesome. Now we're going to go over the choking in adults.
Choking in adults is often caused by food blocking the airway. The block in the airway may be mild or severe. We've all been in a situation where food or drink gets caught in our throat, making it difficult to swallow or even breathe for a few seconds. These situations are called mild airway blocks and are normally relieved without intervention. If a block is mild, a person can make sounds and cough loudly. When this happens, you may want to help, but it's best to stand by and let the person cough. If you're worried about the person's breathing, phone 911. If the block in the airway is severe, then the person cannot breathe, talk, or make sounds. The person may also make the choking sign by holding their throat. If this happens, you need to act right away to try to clear the airway. To help in this situation, you will give abdominal thrusts slightly above the navel. Each thrust pushes air from the lungs like a cough. This can help remove an object blocking the airway. If you think a person might have a severe airway block, follow these steps. Ask if the person is choking and if you can help.
Are you choking? Can I help you?
If the person nods that they are choking and can't talk, you need to act. You'll need to give thrusts slightly above the navel. Depending on your size and the size of the person choking, stand firmly or kneel behind the person and wrap your arms around their waist with your fists in front. Make sure to position yourself so that you are stable in case the person collapses to the ground. Some people find it helpful to stand with their feet shoulder width apart and one leg slightly forward. This creates more stability. Make a fist with one hand. Put the thumb side of your fist slightly above the navel and well below the breastbone. Grasp your fist with your other hand and give quick upward thrusts into the abdomen. Give thrusts until the object is forced out and the person can breathe, cough, or speak. An adult who has been given thrusts should see a healthcare provider as soon as possible. Let's look one more time at how to make a fist. Make a fist with one hand. Put the thumb side of your fist slightly above the navel and well below the breastbone. Grasp your fist with your other hand and give quick upward thrusts into the abdomen. If the person is pregnant or very large, you will need to change how you relieve choking. Put your arms under the person's armpits and your hands on the lower half of the breastbone. Pull straight back to give chest thrusts instead of abdominal thrusts. You can also use this technique for someone in a wheelchair. If you give someone thrusts but cannot remove the object blocking the airway, the person will become unresponsive. In this case, you need to give CPR, but there are a few differences. First, you'll need to get the person safely onto a firm, flat surface. This can be challenging, especially if the person is much larger than you. The best technique is to slowly walk backwards and allow the person to slide toward the floor until they're flat on their back. As you've already learned, when a person becomes unresponsive, shout for help. Phone or have someone else phone 911 and get an AED if they haven't already. Put the phone on speaker mode so that you can talk to the dispatcher. Provide CPR, starting with compressions. After 30 compressions, you will do something a little different from what you were taught earlier. Open the airway and quickly look in the mouth. If you see an object in the mouth, take it out. Do not attempt to reach in and pull anything out that you can't clearly see. This is known as a blind finger sweep. Doing a blind finger sweep may cause the object to become lodged farther back in the airway. Remember, you want to minimize interruptions in compressions to no more than 10 seconds. After checking the mouth, give 2 breaths. Keep repeating the sets of 30 compressions and 2 breaths. Each time you open the airway to give breaths, look for the object in the back of the throat if you haven't already found it. Continue CPR until the person speaks, breathes, or moves, or until someone with more advanced training arrives and takes over.
That was simple.
Drowning and related injuries are a big problem, especially for children. In the United States, drowning is the leading cause of death from unintentional injury in children 1 to 4 years of age. However, there are several steps you can personally take to prevent or limit injuries from drowning. Any person responsible for children around bodies of water needs to be water competent. Water competency is the ability to anticipate, avoid, and survive common drowning situations. According to the American Academy of Pediatrics, evidence reveals that many children older than 1 year will benefit from swimming lessons. But taking swimming lessons and acquiring swimming skills alone cannot prevent all water-related injuries, and they don't drown-proof a child. Parents must install barriers to prevent unanticipated access to water during non-swim times, and they should closely supervise children in and around water. Learning to swim needs to be seen as just one component of water competency, which also includes knowing about local hazards and the risks of one's own limitations. Knowing how to wear a life jacket and being able to recognize and respond to a swimmer in distress, shout for help, and perform a safe rescue in CPR. Experts generally recommend using multiple strategies to prevent drowning because it's unlikely that any one strategy will prevent drowning deaths and injuries. The 5 major evidence-based strategies are 4-sided pool fencing, life jackets, swimming lessons, supervision, and lifeguards. The most studied and most effective drowning prevention strategy for young children is installation of 4-sided residential pool fencing. The fencing should be at least 4 feet tall, with self-closing and self-latching gates that completely isolate the pool from the house and yard. This type of fencing prevents more than 50% of swimming pool drownings of young children. Although the other 4 evidence-based drowning prevention strategies have less robust data compared with pool fencing, life jackets are nevertheless proven to prevent drowning fatalities, especially when worn while boating. Some data reveal that swimming lessons may lower drowning rates among children. Lifeguards and CPR training also appear to be effective because starting CPR and phoning 911 have the greatest impact on survival. However, data about the value of other potential preventive strategies, such as pool covers and pool alarms, are lacking. Inadequate supervision is often cited as a contributing factor when children drown, especially younger children. Adequate supervision, described as close, constant, and attentive supervision of young children in or around any water, is a primary and absolutely essential preventive strategy. For beginning swimmers, adequate supervision is called touch supervision, in which the supervising adult is within arm's reach of the child so they can pull the child out of the water if the child's head becomes submerged. For more advanced swimmers, supervision should include being capable of recognizing and responding appropriately to a child in distress. Remember, no single strategy can completely eliminate a child's risk of drowning, and the best method to minimize the risk is a combination of all the strategies mentioned here to provide multiple layers of protection. For more information on drowning prevention from the American Academy of Pediatrics, visit www.aap.org/drowning.
Good. Done with the adult, going to the infant CPR.
I was just gonna do it, that's what I was doing. Okay, I appreciate
Welcome to the Child CPR and AED section for this course. For the purpose of giving CPR, a child is anyone from 1 year of age to puberty. Puberty is defined as chest or underarm hair on boys and any breast development on girls. If you're unsure of a child's age, treat them as an adult. Children usually have healthy hearts. Cardiac arrest in children often results from breathing problems, but it can also be caused by drowning, severe injury, poisoning, and other problems that reduce oxygen delivery to the body. For this reason, it's very important to give compressions and breaths when giving CPR to a child. Many of the steps you learned in adult CPR will be the same in child CPR. Make sure the scene is safe. Tap and shout. Shout for help. Send someone to phone 911 and get an AED, or phone 911 yourself and put the phone on speaker mode. Check for breathing, and begin sets of 30 compressions and 2 breaths. As you just learned for adult CPR, you need to make sure the child is on a firm, flat surface, like the floor, before you start CPR. You need to push fast at a rate of 100 to 120 compressions per minute, and let the chest come back up completely after each compression. When giving compressions to a child during CPR, you need to push the child's chest down approximately 2 inches or 5 centimeters.
So pretty much the same.
For a child, you can use 1 or 2 hands to give compressions, whichever is necessary for you to adequately push the child's chest down approximately 2 inches, 5 centimeters. If you're alone and don't have a cell phone, it's important to start CPR for children as quickly as possible. In this situation, wait to phone 911 until you have provided 5 sets of 30 compressions and 2 breaths. When you help children, it's especially important that you don't delay the start of CPR. Then, after 5 sets of compressions and breaths, leave the child to phone 911 and get an AED if one is available, before resuming CPR as quickly as you can. Remember to stay on the phone until the 911 dispatcher tells you to hang up. Answering the dispatcher's questions will not delay the arrival of help. Let's watch the steps all together in assessing whether a child needs CPR. Because the main difference between adult and child CPR is what you do if you're alone and don't have a cell phone on you, let's imagine we're in that situation. First, check to make sure the scene is safe. Tap and shout to see if the child is responsive.
Are you okay? Are you okay?
If they're unresponsive, shout for help.
Help! Help!
Unfortunately, no one seems to be nearby. If you had your cell phone with you, you could phone 911 and put it on speaker mode, but regrettably, the phone isn't nearby either. In this situation, it's important to continue the steps of assessing the need for CPR and wait to phone 911. Scan the chest for 5 to 10 seconds. If the child is not breathing or is only gasping, provide CPR. Make sure the child is lying on their back on a firm, flat surface. Quickly move bulky clothes out of the way. If a child's clothes are difficult to remove, you can still provide compressions over clothing. If an AED becomes available, remove all clothes that cover the chest. AED pads must not be placed over any clothing. After 5 sets of 30 compressions and 2 breaths, if no one has come to help, leave to phone 911 and get an AED if one is nearby. You've learned how to assess the need for CPR and phone 911. Now let's focus on compressions and how they should be done. Chest compressions for a child are not that different from compressions for adults. You need to push hard and fast in the center of the chest. When providing compressions to a child, start by using one hand for compressions. If you can't push down approximately 2 inches, which is 5 centimeters, with one hand, use 2 hands to compress the chest. Sometimes people don't push hard enough during child CPR because they don't want to hurt the child. However, it's better to push too hard than not hard enough. Let's watch this demonstration.
I think that's one advantage we have as massage therapists is that we can feel the body better.
Mm-hmm.
So I think once your hands is on the sternum, like right underneath the sternum, I think we can tell better than normal people could probably tell how far it's going down, if we're getting the right depth or not. So I think that's a benefit.
You need to push hard and fast in the center of the chest, approximately 2 inches or 5 centimeters. at a rate of 100 to 120 compressions per minute. It's helpful to keep your elbows fully extended. Finally, you need to allow the chest to come all the way back up after each compression. Now that we've reminded you how to give chest compressions, it's time to add the next important skill in providing high-quality CPR, giving breaths. As with chest compressions, giving breaths to a child is very similar to giving breaths to an adult. One difference to consider is that for small children, you won't need to blow as much air in each breath as you would for larger children or adults. Also, if you're using a pocket mask to give breaths to a child, make sure to use a child-sized mask if available. This will help ensure a proper seal, resulting in effective breaths. Let's watch this demonstration. Put one hand on the mannequin's forehead and put the fingers of your other hand on the chin. Then, tilt the head back and lift the chin. While holding the airway open, pinch the person's nose closed with your thumb and forefinger. Take a normal breath. Cover the mannequin's mouth with your mouth. Give 2 breaths. Blow for 1 second for each breath. As you give each breath, you should look down at the mannequin's chest to see it rise.
So we kind of went over there with the adult. Not too much of a difference on that one there. This is a 3-hour.
First, check to make sure the scene is safe. Tap and shout to see if the child is responsive. Are you okay? Are you okay? If they're unresponsive, shout for help. Help! Help! I need help! Scan the chest for 5 to 10 seconds. If the child is not breathing or is only gasping, provide CPR. If the child is breathing normally and is unresponsive, place the person on their side until someone with more advanced training arrives.
Any questions about that?
No, sir.
You need to push hard and fast in the center of the chest, approximately 2 inches or 5 centimeters, at a rate of 100 to 120 compressions per minute. Finally, you need to allow the chest to come all the way back up after each compression.
Kids are a little empty on the inside.
Put one hand on the mannequin's forehead and put the fingers of your other hand on the chin. Then, tilt the head back and lift the chin. While holding the airway open, pinch the person's nose closed with your thumb and forefinger. Take a normal breath. Cover the mannequin's mouth with your mouth. Give 2 breaths. Blow for 1 second for each breath. As you give each breath, you should look down at the mannequin's chest to see it rise. Let's look more closely at using an AED for children. Even though you may be in the middle of providing CPR, once an AED arrives, use it immediately. Just as with adults, the use of an AED gives the child the best chance of survival. It's just one more step in giving the child the best chance of survival. The steps for using an AED on a child are the same as for an adult. However, there is one main difference. If your AED is equipped with smaller pads, a child key or switch, use them for children younger than 8 years of age. The small pads or child key or switch will deliver a shock with a lower energy dose than the larger pads will. But if there aren't any smaller child pads, or if there isn't a child key or switch, use the larger adult pads. There are many different brands of AEDs, and although they may differ slightly, the same basic steps apply to all of them. When you put the pads on the chest, make sure they don't touch each other. If a child is very small, you may need to put one pad on the child's chest and the other on the child's back. Follow the pictures on the package or pads. Now we're going to demonstrate how to put it all together, from scene safety and assessment to providing compressions, giving breaths, and using an AED. As the rescuer, check to make sure the scene is safe. Next, tap and shout.
Are you okay? Are you okay?
Then, shout for help.
Help! Help!
And ask someone to phone 911 and get an AED.
Phone 911 and get an AED.
Then, scan the chest for 5 seconds, but no more than 10 seconds, checking for breathing. If the child is not breathing or is only gasping, begin CPR starting with compressions. Make sure they're on a firm, flat surface. Quickly move bulky clothes out of the way. If a child's clothes are difficult to remove, you can still provide compressions over clothing. If an AED becomes available, remove all clothes that cover the chest. AED pads must not be placed over any clothing. Give 30 chest compressions. Now, tilt the head back and lift the chin and give 2 breaths. Continue sets of 30 compressions and 2 breaths until the AED arrives. Once the AED arrives, use it immediately. First, turn on the AED by pushing the on button or opening the lid. Attach the pads to the child's bare chest. Follow the AED prompts and the pictures on the package or pads. Make sure no one is touching the child while the AED analyzes the heart rhythm and before you push the shock button. Press the shock button if the AED says to. Immediately resume CPR, starting with compressions. Remember that performing CPR requires a lot of effort. It can be tiring to keep up the pace. Therefore, if someone else knows CPR, take turns providing CPR, switching about every 2 minutes even if you're not tired. A good time to switch is when the AED is analyzing the rhythm. As you help each other and take turns providing CPR, it's important to give each other feedback. While you're resting, remind the other rescuer to push down approximately 2 inches or 5 centimeters at a rate of 100 to 120 compressions per minute, and to let the chest come back up to its normal position after each compression. This concludes the child CPR and AED section of the course.
Any questions about any of that?
As you learned with adults, choking in children is often caused by food blocking the airway. The block in the airway may be mild or severe. If it's mild, the child can make sounds and cough loudly. If this happens, stand close by the child and let the child cough. If you are worried about the child's breathing, phone 911. The steps for helping a child with a severe airway block is the same as for adults, with one exception. If the child is smaller, you may have to kneel to get into the correct position. If the child is too large for you to wrap your arms around the waist, put your arms under the child's armpits and your hands on the center of the child's chest. Pull straight back to give thrusts on the chest instead of the abdomen. You can also use this technique for a child in a wheelchair. A child who has choked and been given abdominal or chest thrusts should see a healthcare provider as soon as possible. If you give a child thrusts but cannot remove the object blocking the airway, the child will become unresponsive. When a child with severe airway block becomes unresponsive, you'll want to respond the same way as with an adult. Shout for help. Phone or have someone else phone 911 and begin compressions. After 30 compressions, open the airway and look in the mouth. If you see an object in the mouth, take it out and give 2 breaths, but do not perform a blind finger sweep. Repeat giving sets of 30 compressions and 2 breaths, checking the mouth for an object after each set of compressions. After 5 sets of 30 compressions and 2 breaths, if no one has come to help and you don't have a cell phone, leave the child to phone 911 and get an AED. Use the AED as soon as it is available. Keep providing 30 compressions and 2 breaths. checking the mouth for an object after each set of compressions until the child starts to respond or until someone with advanced training arrives and takes over.
So that's child. We're going on to our last one now. Not too much of a difference in child and adult. It's probably the one hand for the compression, just in case you're, depending on the size of the child, you don't want to cave their chest in, of course. So, just minor details that you would pick up on instinctively. All right, let's go to infant CPR.
Welcome to the infant CPR portion of the American Heart Association's HeartSaver CPR AED course. For the purposes of this course, an infant is anyone younger than 1 year of age. Just as in adults and older children, when an infant's heart stops beating, blood stops flowing through the body. Because infants are so small, you'll perform CPR differently on them than you would on children or adults. When providing compressions to an infant, you use just 2 fingers of one hand or the 2 thumb encircling hands technique instead of using 1 or 2 hands as you would for children and 2 hands as you would for adults. If you can't achieve the appropriate depth, you can use the heel of one hand just as you learned in CPR for children. Another difference in infant CPR is that you should push down approximately 1.5 inches, which is 4 centimeters, at the rate of 100 to 120 compressions per minute. This is the same rate that you already learned for adult and child CPR. When dealing with an unresponsive infant, it can sometimes be hard to be certain if the infant needs CPR. If the infant is not responsive and isn't breathing or is only gasping, start CPR. It's better to give CPR to an infant who doesn't need it than not to give it to an infant who does need it. CPR is not likely to cause harm if the infant is not in cardiac arrest, but without CPR, an infant who is in cardiac arrest may die. Here are the steps in assessing whether an infant needs CPR. First, make sure the scene is safe. Look for anything nearby that might hurt you or the infant. Check if the infant is responsive. Tap their foot and shout their name. If they don't move, make a sound, blink, or otherwise react, they're unresponsive. Shout for help. If someone comes, have that person phone 911 and get an AED.
So still the same.
If no one has come and you're alone and have a cell phone,
Just
phone 911 and put it on
Exactly.
speaker.
And
Listen
this
to the
time you're
dispatcher's
tapping the infant's
instructions.
foot
Next,
to
check
shout to
the
see if
infant's
they're
breathing
responsive.
by scanning the chest for 5 to 10 seconds.
Mhm.
If the infant is not breathing or is only gasping, provide CPR. Make sure the infant is lying face up on a firm, flat surface. Quickly move bulky clothes out of the way. If an infant's clothes are difficult to remove, you can still provide compressions over clothing. If an AED becomes available, remove all clothes that cover the chest. AED pads must not be placed over any clothing. Give sets of 30 compressions and 2 breaths. If you don't have a cell phone and the infant is not injured, after 5 sets of 30 compressions and 2 breaths, you may carry the infant with you to phone 911. Keep giving sets of 30 compressions and 2 breaths until someone with advanced training arrives and takes over. As you know, to provide high-quality compressions, you do 4 things. Provide compressions that are deep enough. Provide compressions that are fast enough. Allow the chest to return to its normal position after each compression, and don't interrupt compressions for more than 10 seconds. When providing high-quality compressions, pushing hard and fast is just as important with infants as it is with children and adults. Make sure the infant is lying on their back on a firm, flat surface. Some people find it easier to use a raised surface. Quickly move bulky clothes out of the way. If an infant's clothes are difficult to remove, you can still provide compressions over clothing. If an AED becomes available, remove all clothes that cover the chest. AED pads must not be placed over any clothing. Remember, one of the main differences in infant CPR is that you use just 2 fingers or 2 thumbs to provide compressions. Watch this placement if you're using 2 fingers on the infant's chest. Put 2 fingers of one hand on the breastbone, just below the nipple line. Press the infant's chest straight down approximately 1.5 inches, which is 4 centimeters. After each compression, let the chest come back up to its normal position. You'll need to give compressions at a rate of 100 to 120 compressions per minute. Watch this demonstration for placement if you're using the 2-thumb encircling hands technique on the infant's chest. Encircle both hands around the infant's chest, placing your thumbs on the breastbone, just below the nipple line. Press the infant's chest straight down approximately 1.5 inches, which is 4 centimeters. Remember, if you can't achieve the appropriate depth, you can use the heel of one hand just like you learned in CPR for children. Now, the video will pause while you get into position to practice providing chest compressions to an infant.
I'm gonna leave him in the chair and pull him up to you.
Okay, that's fine.
Have a great day. Yeah, this was my off day.
Enjoy thyself.
I tried.
Put 2 fingers of one hand on the breastbone, just below the nipple line. Press the infant's chest straight down approximately 1.5 inches, which is 4 centimeters. After each compression, let the chest come back up to its normal position. You'll need to give compressions at a rate of 100 to 120 compressions per minute.
We're supposed to do 30, right? I'm already doing 30.
Right.
30 and then 2 breaths and then do 30 again. Okay.
See, I have to keep myself into it. My grandmother come around talking, I hate to have to beat on my back and be like, oh, I know CPR, I just forget.
As with children, when an infant's heart stops beating, it's usually because they can't breathe or have trouble breathing. Therefore, it's important to give breaths as well as compressions.
It was nice meeting you. Thanks again.
When you give a breath, opening the airway correctly will help keep an infant's tongue out of the way. Opening the infant's airway too far can actually close the infant's airway, making it difficult to get air inside. Follow the techniques you're about to learn to make sure you open the infant's airway correctly. So, let's look at the steps for opening the airway and giving breaths to an infant. And remember, this should be done quickly during CPR, never interrupting chest compressions for more than 10 seconds. We'll show you how first, and then you'll get a chance to practice. To open the airway, follow these steps. Tilt the infant's head by pushing back on the forehead and put the fingers of your other hand on the chin. It's important to avoid pressing into the soft part under the chin because this might block the airway. Also, don't push the head back too far. This might close the airway as well. The infant's head should be in a neutral position. While holding the airway open, take a normal breath. Cover the infant's mouth and nose with your mouth. Give 2 breaths. Blow for 1 second for each. As you give each breath, you should look down at the infant's chest to see it rise. Infants don't need as much air as adults or even children to make the chest rise, but you'll only know the infant has gotten enough air if you do see the chest rise. Let's watch one more time.
2 breaths. So 1.
If you have difficulty making an effective seal, try either mouth-to-mouth or mouth-to-nose breaths. If you use the mouth-to-mouth technique, pinch the infant's nose closed. If you use the mouth-to-nose technique, close the mouth. Sometimes you'll find that your breaths aren't making the infant's chest rise. If you give a breath and the chest doesn't rise, quickly reopen the airway by allowing the head to go back to the normal position and then open the airway again. Give another breath and make sure the chest rises this time, interrupting compressions for no more than 10 seconds total. If the chest doesn't rise, resume compressions. To open the airway, follow these steps. Tilt the infant's head by pushing back on the forehead and put the fingers of your other hand on the chin. While holding the airway open, take a normal breath. Cover the infant's mouth and nose with your mouth. Give 2 breaths. Blow for 1 second for each. As you give each breath, you should look down at the infant's chest to see it rise. You may get breaths with or without a pocket mask. If you work in a place that cares for infants, your employer may provide personal protective equipment, including pocket masks, for use during CPR. Infant masks and face shields function in the same way as those made for adults and children. It's important that you use a barrier device that's the correct size for the infant. So let's take a look at how to give breaths with a mask. We're going to show you a demonstration on how to place the mask and give breaths. Afterwards, we'll give you a chance to practice. We'll start next to the infant. Put the mask over the infant's mouth and nose. If the mask has a narrow or pointed end, place that on the bridge of the infant's nose. The wide part of the mask should cover the infant's mouth. Tilt the head and lift the chin while pressing the mask against the infant's face. It's important to make a good seal between the face and the mask while you lift the chin to keep the airway open. Make sure to keep the infant's head and neck in a neutral position. Don't tilt the head too far back or you risk blocking the airway. Now that you've got the mask positioned, give 2 breaths while watching for the chest to rise. Actually seeing the chest begin to rise is the best way to know that your breaths are effective. Remember, if the chest doesn't rise after you give a breath, tilt the head back and lift the chin and try again. You should try to give 2 effective breaths within 10 seconds. Now we're going to practice. The video will pause so that you can put your mask together and get into place.
Bring your head back, fingers under there. 2 1-second breath,
Yes.
and then go into compressions again.
Right.
And then I'm guessing you do 2 breaths again and do the
Right.
again.
Same routine, just different motion, fingers positioning.
We'll start next to the infant. Put the mask over the infant's mouth and nose. Tilt the head and lift the chin while pressing the mask against the infant's face.
Good.
Give 2 breaths while watching for the chest to rise.
Good rise, good rise. Good job. Any questions about any of that?
No, sir.
Good job, good job.
So I never have to work on a Smurf baby like the car.
I know, right? Look at that thing.
Definitely bow-legged too.
Mm-hmm.
You have now learned infant CPR and are prepared to act in the event of an emergency.
Nice.
Now, the video will pause for your instructor to test you on these infant CPR skills.
Okay, so pretty much we had, once you come into the infant on this one, it's pretty much tapping the feet to see if the infant responds. Once we check to see, and pretty much after that, it's the adult CPR we're scanning, we're getting someone to call 911, shouting for help. They do use an AED, but I don't think they're going to do it in this one here. Doesn't look like it. They don't have it on here.
Yeah.
But I do have the infant pads for AED as well. But I'm sure for children, that's for very emergency important reasons. And then once you come to them, you want to begin the CPR compressions, and then just like you were just doing, get your 2 fingers, get your 30 times, breathe in, breathe, come back, compression again. Kind of like how you were just doing. So, I mean, you were doing it with the video, so I seen you can do it.
Yeah.
So we're good on that part. So we're going to go ahead and look at choking in infants.
Choking is also a common emergency with infants. When an infant has severe choking, you need to act quickly. You'll use a combination of back slaps and chest thrusts to help remove the object blocking the airway. Hold the infant face down on your forearm. Support the infant's head and jaw with your hand. If a chair is available, you may want to sit and use your lap to support your arms. Even small infants can sometimes feel heavy, and it's very important to keep the infant's head down vertically to allow gravity to help dislodge the object. Give up to 5 back slaps with the heel of your other hand between the infant's shoulder blades. If the object does not come out after 5 back slaps, turn the infant onto their back while supporting their head. Give up to 5 chest thrusts by using 2 fingers of your other hand to push on the chest in the same place you push during CPR. Repeat giving 5 back slaps and 5 chest thrusts until the infant can breathe, cough, or cry, or until they become unresponsive. Give only back slaps and chest thrusts to an infant. Giving thrusts to the abdomen of an infant could cause serious harm. As with adults and children, never perform a blind finger sweep. Reach into the infant's mouth to pull out an object only when you can see it. Any infant who has been given back slaps and chest thrusts should be seen by a healthcare provider as soon as possible. The video will now pause for you to get in position to practice back slaps and chest thrusts on an infant.
All right, so we'll do 2 rounds of that.
Okay. 1, 2, 3, 4, 5.
Correct.
1, 2, 3, 4, 5.
Oh, my baby! Get my baby back! Oh no, my baby! Good job. Any questions about that?
My baby was a NICU baby, so I had to take classes when she was in the hospital.
My son, he was in
Hold
the
the
NICU
infant
11
face
days.
down on your
We're
forearm.
in there for a moment.
Support the infant's head and jaw with your hand. Give up to 5 back slaps with the
worst.
heel of your other hand between the
I had
infant's shoulder
Almost
blades.
2 months early.
If the object does not come
He
out after
swallowed
5
some
back
of his
slaps,
fecal
turn the
matter.
infant onto
And it
their
messed
back
up his
while supporting
breathing.
their head. Give up to
Yeah, you can
5
like see
chest
the heart
thrusts by using
up.
2 fingers of your other hand
Heart
to
will
push on the
beat
chest
up.
in the same place you push during CPR.
Do me like
Repeat giving 5 back slaps and 5 chest thrusts until the infant can breathe, cough, or cry, or until they become unresponsive.
People get paid for this too, man. People get paid for this.
During the process of giving back slaps and chest thrusts, if the infant becomes unresponsive, do the following. Place the infant face up onto a firm, flat surface and then shout for help. If someone comes to help, have that person phone 911 and get an AED. If you're alone and you have a cell phone, phone 911 and put it on speaker mode. Provide chest compressions in the same place as you would for CPR. After 30 compressions, open the airway and look in the mouth. If you see an object in the mouth, take it out. Give 2 breaths. Each time you give breaths, first check the mouth for an object and remove it if you see it. Repeat giving sets of 30 compressions and 2 breaths. Exactly as you just learned, after 5 sets of 30 compressions and 2 breaths, if no one has come to help and you don't have a cell phone, then take the infant with you and phone 911 and get an AED. Use the AED as soon as it's available. Keep providing 30 compressions and 2 breaths, checking the mouth for an object after each set of compressions until the object comes out, the infant starts to respond, or someone with advanced training arrives and takes over.
Alrighty. Let's get back to the menu. And now we're just going to go to the conclusion. Good job, good job.
This wraps up our Heart Saver CPR AED course. By taking this course and stepping up to help when someone needs CPR or choking relief, you are increasing that person's chance of survival. The knowledge you've gained today can help you change or even save someone's life. If you practice your skills often to keep them up to date, you'll have the best chance to help someone who may need immediate assistance when an emergency occurs. Your student workbook is a great resource, so use it to review this information between training courses. At the American Heart Association, we remain committed to exceptional training. Go to heart.org/CPR for more information on our courses and to learn more about our mission. On behalf of the American Heart Association, we congratulate you and thank you for taking the time to attend this important course.
Good job. Alright, so pretty much now we'll do a written test. I'll print the certificate out. Thank you, thank you.